Hospital with regards to this latest saga. Let's now bring in our medical correspondent here at KTN, Dr. Mercy Kori, joining us in studio. Thank you very much. Let's just begin with a question that Sharon Momanya has posed in her story that just ran. What are the guidelines for when an infant dies in a maternity hospital?
Now, let's, from Sharon's story, PUMWANI does not have a mortuary, it does not have a morgue, it does not even have a cold room. So what happens is the hospital has a holding room. This is a place where they temporarily keep bodies. That is both mothers who may or can die during delivery for whatever reason, and also the infants and the neonates and the stillbirths born at the hospital. They have a holding room separately for this. Now, as she said, on Mondays, Wednesdays and Fridays at 8 a.m. promptly, they hire a hearse that transports these bodies from PUMWANI to the city mortuary. Now, they have a mortician who, when a mother or a baby dies, the procedure is the doctor will certify that actually a death has occurred. Then there are forms to be filled. They will be filled. Then the nurses will ask the mortician to come and collect the body. In each and every step of this, there are forms, there are documents to be filled, and there's always a tracking record for all these deaths that have occurred, and up to the holding room and up to city mortuary. Now, as we've seen, the 11 bodies have been accounted for by the management at PUMWANI, who they've said between Friday the 14th and Monday the 17th, 8 a.m., they had 156 deliveries. Out of these 156 deliveries, they reported 6 deaths. Out of these 6 deaths, one that was transferred in, and 5 were due to circumstances around the hospital. Some mothers came in late, and others had complications during delivery, so they had the 6. Now, on Friday, 4 bodies that had been there since Wednesday 8 a.m., that was the last collection, and Friday 8 a.m. had not been collected, making the tally to 10. Now, the hospital cannot account for 1 body, which the governor and his entourage found there. And you've seen the pictures of, they've been graphic, they've been gory. First of all, in a hospital, whether somebody is alive or dead, everything is kept private for the mothers, for the babies. So we've seen all these photos, and we've seen a baby that we cannot account for.
There's a growing concern from Kenyans on why really were these babies put in polythene bags and carton boxes. Is there an explanation to that?
No, remember, we don't have a cold room. We don't have, it's a holding room. It's a temporary storage. Now, most of these babies, actually, almost 100% of the time, the relatives or the mothers would not claim them. So they have to be disposed in a different way. So normally, because it's just a temporary storage, the ideal or best way would have been to have body bags for this. But they're either kept in polythene bags or in carton boxes, just as temporary storage before they are transported. And usually they are wrapped very well before they are transported to the city mortuary. So we've seen these lapses. And just to add, what we've seen, actually, I wouldn't say it's an issue of the nurses or the doctors or the clinical officers. I've seen that there's been ordered that the medical board and the relevant authorities should investigate. This is actually an issue of governance, because a cold room in such a referral hospital should have been something that has been budgeted for and constructed, even a mortuary, because it's the largest maternity referral hospital that we have. So all these things that we are seeing in the health sector all boil down to a governance issue. Because if the governance does not steer or does not know what is ideal, and so that they can budget and lead people to that particular place,